Real food allergies can be very dangerous, more dangerous than most people realize. Hi everyone, my name is Dr. Mary Lee-Wong, and today I wanted to talk about a topic that I find very important for patients that I see in clinic. I've seen many Chinese patients in the US after eating nuts develop some severe itching, red rash, swollen lips being tingling, or maybe they have shortness of breath. So they've had symptoms for a long time. Even if you're an adult and even if you're a child, it doesn't matter what age. Food allergies can occur at any age. Remember, food allergies can lead to problems breathing, a drop in your blood pressure, passing out, and unfortunately, it can be life-threatening. So it's important that you get evaluated, tested, and treatment. So how do you test for food allergies? Usually when you come to my office, we will start off with a medical history. I need to know what medicine you've been taking, what other history that you have. Like, for example, are you diabetic? Do you have high blood pressure? Have you had surgery? Then we want to know, what are your symptoms? And for food allergies, I need to know, what were you eating? Then I will do skin testing where I put small amounts of the allergen on the skin, and if redness or swelling appears, that will suggest an allergy. Now again, no test is 100%. So we do a bunch of tests. We may do a second test, we may or may not, where we do a blood test to check for Ig antibodies. Even if you have a positive test, it doesn't always mean you have food allergies. You can have tests that has false positive, where the test is positive, but you need a different test and the clinical history. How did you present before we make a diagnosis of what is happening for you? Some patients may even need an oral challenge. We call this an oral food challenge test, where we will actually give you the suspect food under medical supervision. Well, I always say for allergies, for food allergies, there's acute treatment and there's chronic treatment. Acute treatment is if you have problems breathing, you're passing out. In that case, we want you to always have an epinephrine auto-injector. An epinephrine auto-injector has many different brand names, an EpiPen, an AviQ. There's all these different medicines that we can prescribe. You can self-administer by injecting yourself on the thigh, or in the case of epinephrine nasal spray, you can put it in your nose. So many people say, I can't give myself the injection. That's so scary. That's my job. My job is to not only prescribe it, but to show you how to use it, how to inject it, and make you comfortable. In a severe reaction, this injection can save your life. Once you give yourself the injection, you must immediately go to the emergency room to get treatment. Now, there's acute treatment and there's chronic. Chronic treatment, we have medications that we can use. It's called amazumab. It's a biologic, which is a new type of medicine. And actually, they've developed more biologics for the treatment of food allergies. And these medicines are a safety net that in the event that you have accidental exposure, then it can give you some protection. It doesn't mean you should just keep eating, but just it helps in case you have cross-contamination. So we have many things that we need to discuss. It's hard for me today to discuss all of it because each person is different. So you need to come and see an allergist so we can work together, you and I, so we can discuss what we can do. For example, you can get oral immunotherapy, where patients are exposed to small amounts of the food allergen that you're allergic to under medical supervision to increase tolerance so that you can be more tolerant and less likely to react so much or so severely to the food. And there's always medication. So there's a lot of things we can do. We have a lot of potential treatment plans. So come and see me or see a practitioner so that we can work together to figure it out as a team, because your health and your well-being is the most important thing. Thank you so much for your time today. 北美华医讲堂，这是就是健康。